I'm here with Esther Lynch, Confederal Secretary at the European Trade Union Confederation. And today we're going to speak about working conditions and occupational health and safety and her top priorities during the upcoming months and years. Thank you very much for being here with us. Would you please briefly describe us your top priorities as a Confederal Secretary?
Well, the top priorities for the ETUC for the coming years are to improve health and safety for all workers in Europe. We have a couple of themes within health and safety that we're working on this year. One of those is work-related cancer. Another is to improve the situation in relation to psychosocial risks and musculoskeletal disorders, and also to try and empower health and safety reps in the workplace. But we want to take a focus on both men and women in their workplaces.
You mentioned the gender issue in occupational health and safety. One would tend to think that in terms of occupational health and safety and working conditions are concerned, men are and women are protected equally. Isn't that the case?
I think the biggest problem that women have in relation to health and safety at work is having their situation recognised as being different to men. Often risk assessments don't take into account the differences between either the work that women do or the impact of the work on women. For example, you often see that machines aren't designed for women's work, the personal protective equipment doesn't fit, but also it's almost invisible in risk assessments, the fact that women do a lot of work that has the same impact. So, for example, care workers often lifting very heavy loads, women working with chemicals at the end of the process, often not recognised. So you'll see a good risk assessment where the chemical is being made, but not so much of a risk assessment where the women, for example, in cleaning or in other industries, are using the chemicals at the end of the process.
I wonder if you could, as ETUC Confederal Secretary, provide some ideas, and what would you suggest for unions to do within the issue, the issue of the gender issue, and in order to keep women's health protected in a better way?
Well, what we know for sure is that trade union health and safety committees make workplaces safer. So what's absolutely critical is to include women within those health and safety committees, and really to encourage a lot more women to come forward and to participate, to give them the skills so that they can do that. But also we need a lot more research. So, for example, work-related breast cancer, the biggest cancer cause of death for women in Europe is breast cancer, but we know very little about the work-related aspects of this. What we know is that risk factors include night work, shift work, but also some chemicals, and yet very little information is available, and most importantly, we don't know what advice we can give to women to protect themselves properly at work from work-related breast cancers. The other pieces that we're missing are information for pregnant workers in relation to endocrine disruptors, reprotoxic chemicals. So there's a lot of information that we need, a lot more research that we need. But what we know for sure is that trade union-led health and safety keeps workers safe. So it's important that women are encouraged to come forward and to be part of those committees.
Well, Esther, thank you very much for being here with us and for pointing out at different challenges. We hope to having you again at ETUI. And for those who would like to know more about the topic, we have published this recent HESA mag on gender, work and health, and you can read it, and it's available at the ETUI website.